October is Breast Cancer Awareness Month.
It's a very good time to remind women and men about the latest screening recommendations.
There's also some news on the vaccine front regarding local supply of COVID and flu shots. Lots to talk about as usual today with UW Health's Dr. Jeff Pothof. Welcome back.
Pothof.
Hey, guys.
Let's start with the flu mist. We call it a vaccine, but it's not a vaccine. The vaccine implies a shot, right?
It's still a vaccine, but you get the vaccine differently. So I think we're used to you get the shot, it goes in your muscle, your immune system reacts. With flu mist, it's a liquid, and then on the end of that syringe is an atomizer, which basically kind of aerosolizes that liquid. It sticks to your mucous membranes, and your immune system develops immune response that way.
As good as a shot?
It's basically comparable in that age group from 2 to 49. They think as you get older, maybe the flu mist is not quite as good. Most of those older individuals should be getting the regular flu shot.
We'll follow it and see what happens with the FDA.
It's not approved yet.
Not approved for home administration.
For home administration, yeah. Let's talk about Breast Cancer Awareness Month. October is winding down quickly. What are the latest screening recommendations for women for mammograms?
Yeah, so currently here in the United States, recommendations are not final, but it's 40 and older. So if you're age 40 or older, what will typically happen is at age 40, your doctor will start talking to you about breast cancer screening. It's not like a hard recommendation, but not a bad idea at age 40. It's kind of the risk-benefit is about even there. Certainly, once you're age 50 to 74, really good evidence that breast cancer screening can catch breast cancer early. Outcomes are much better in that case. Really recommend everyone to get that done on an annual, maybe for some people every other year basis. At age 74 or older, it really has to do with your expected life expectancy. So folks that are healthy, they're doing really well. Continue to screen is not a bad idea. Once you feel like, hey, you probably don't have more than 10 years left to live, not necessarily that you get that done.
How about men? Yeah,
so for men, there's not like a universal, like men should get screened for breast cancer, but I think a lot of men will find it unusual that male breast cancer is a thing. About 1% of breast cancers happen in men. Things that would make you get screened if you're male. There's genetic markers that significantly increase your risk for breast cancer, namely BRCA1, BRCA2. If for whatever reason you've been tested for that and you're positive and you're a man, that might be a reason to get breast cancer screening, typically over the age of 50. And then also if you have a condition called gynecomastia, where your breast tissue is enlarged compared to, say, most men, that's another indication that you might want to talk to your doctor about getting screened for breast cancer.
Okay. All right. Let's talk a little bit about local supply of vaccines. We've been talking about that week after week, how difficult it is to get an appointment to get a COVID vaccine. UW Health is bringing back the drive-through clinic.
Yeah, you know.
Why not?
Why not? Yeah, no. I think this is a great option. So one, supply is much better now. I mean, we've been talking about this for a few weeks. So we've essentially, caught up. We've gotten our supply. And for something like a vaccine, everyone is so busy. So this idea that you've got to sit down and make an appointment and go to your clinic and get your shot, that's great, but for a lot of folks that just doesn't work for them. So having the John Wall Drive site where you can drive through, roll up your sleeve, put down the window, you get your shot and you're on your way out of there, that's a pretty convenient option. For that to happen, you have to be a UW Health patient. We've talked about it before, how vaccines have kind of changed as far as insurers paying for it. But both COVID, flu, and a lot of our other vaccines, as long as you're not too young, that's an option for folks.
You stay in your car, you roll down the window and get a jab.
You roll down the other window to get the other arm?
You could, yeah.
So what is the state of COVID right now in Dane County?
Yeah, I think, we've been in a bit of a steady state. So a number of weeks ago, we went from that very low level to a slightly higher level. And for the most part, we've kind of been just staying right there. And as far as other viral illnesses, not seeing a lot of RSV and flu here right now in Dane County, but it's coming. There's other parts of the U.S. where they're seeing a lot more RSV, a little bit more flu. It's just a matter of a few weeks, and we'll probably start seeing quite a bit more of it here.
And it takes a couple of weeks for the vaccine to kick in.
Absolutely. Anywhere from probably 10 to 14 days before you start getting some protection. So if you're not vaccinated yet, you want to get that done soon, because pretty soon you're going to find it too late. You're going to go get vaccinated, but you've already got the flu or
you want to
COVID.
take a flight or something. And
yeah.
All right. Good information as always, Jeff.
You bet. Thanks. Appreciate it.
See you next week. The final check of your forecast coming up.